My argument is why fructose is not a health risk for gout. Gout or gouty arthritis is a common form of inflammatory arthritis in the United States. It is characterized by the accumulation of uric acid that forms crystals of monosodium urate. These crystals stored within and around the joints, ligaments, and tendons, and it causes a lot of pain. Gout is a metabolic condition as well as hyperuricemia or the accumulation of uric acid. And these metabolic conditions are associated to other common diseases like hypertension, insulin resistance, obesity, kidney diseases. There are multiple risk factors for gout development, such as genetics, age, gender, use of diuretics and other drugs, alcohol, and lifestyle factors. Fructose has been associated as a risk factor for gout development. Fructose can be found in the sweeteners sucrose and high fructose corn syrup. These sweeteners also contain glucose. The relation between fructose intake and concentration of uric acid has been studied but has generated mixed results. Some studies have used a dose of fructose that doesn't correspond to a real consumption. It's been overestimated. In another study, they measure the concentration of uric acid with an isocaloric fructose intake in diabetic and non-diabetic patients, and they didn't find any increase in the concentration of uric acid. Over the past 10 years, the fructose intake in the United States has been in decline. So a positive correlation of fructose intake and prevalence of gout can't be established. Since dietary sources of fructose also contain glucose, the effect of glucose on the concentration of uric acid cannot be neglected. There is a lack of clinical trials that show a direct relation between fructose intake reduction and release of gout symptoms. Since healthy lifestyles and a moderate diet will lead to overall health, to say that fructose is a direct risk factor for gout, it's just an unfounded statement. Thank you.